Namaskar. Welcome to the next session. It is number 6, Establish a Healthy Foundation. We are going to do 2 asanas today, and it's going to be Janushirasana and Utkatta Vajrasana. Now, may slightly be different from the usual Vajrasana that you know, because Utkatta is a little bit difficult. Okay, now let's do some warm-ups before we start the 2 asanas. Janushirasana, it's a forward bending pose. It requires stretching the back of the legs. I'm going to just do a little bit lying down so we could stretch the legs in the sitting and standing pose as well. We're going to do the stretching before we do the 2 very interesting lower part of the body. No, actually, Utkatta Vajrasana also affects the upper part of the body very much. Let's lie down, let go of all the tension in the body. Just soften the body for 1 minute. It's really useful actually before you use the muscle. You need to bring your arms and just rotate your arms, rotating, massaging the back of your shoulder blades. You feel that, especially if there are lots of bumps in the body, in the upper part of the body. Just one more time. I'm trying to massage and release some tension and change direction. And 2 and 3. Till least give yourself a stretch, pointing the toes away from you, pointing the toes towards you. And away from you. You feel that getting into your back, into your fingers, hands, and then pointing towards you. And slowly release it, release it, release it. Bring the legs together all the way up. Just point towards you and away from you. Towards you, away from you. And the knees exhaling, inhaling. Just alternating these legs. Kicking a little bit. And exhaling, knees together. And knees bend, feet close to your bum. I'm going to ask you to raise the back a little bit. Raising. Stay for a while. And exhaling down. Be careful with the knees when you come up and down. This is a very important part, that you don't injure the knee, and do it very slowly so you recognize what position you might get a little bit straining. Just again, one more time. And lower the legs down. One more time now with the arms up. Raising the arms. And lowering the arms. Again, arms up. I want you to bring just one arm down, maybe the right arm down, and lower the body. And left arm down. Bring the arms up, body up. Right arm up, turn to the left side. And right arm down, body coming up, alternating. And left side, looking to the right. Left down, coming up. One more set. Right arm up, turning head to the left, turning back to the center. Right arm down, left arm up, turning to the right. And left arm down. And slowly coming down. Bring the knees to the chest. Straighten the legs. And again, back, knees bend. Then drop the knees just to one side. Doesn't matter right or left, just drop it to one side. You may look at the opposite side. Just dropping the legs for a while. Feel that pull or stretch in the sacrum, the triangle of your lower back. We're going to use those muscles for the asanas. Back to the center. And the other side. I like this stretching. Is really nice for even the hip area, the back of the kidneys area, and the sacrum. They're very much confused sometimes. We do not know which muscle we are using, but they're really nice for those stretches for those areas. Okay, exhaling and release. We're gonna go into just for a while before we come to the sitting, or we rotate up to the sitting. You're gonna roll up instead of, you can turn to the right and come up, and we're just gonna roll up. Exhale, come to the sitting. Stay up with your legs are straight. Bring your right foot to the inner thigh of the left leg. Or for the brothers, actually, you can press into your Muladhara chakra. So this is Janu Shirasana. We are going to do 4 sets of that. We start with the left side, left leg. Okay, now you can see that you need to move your body a little bit to the left because you're facing the left leg. I'm going to do one pose. We just, all right, we're going to continue. We'll start inhaling, first lengthening. Lengthening, you can feel the muscle pull on the side, so be careful that you don't overstretch it. You can also feel the stretch on the rib cage. Lengthening, shoulders are not tight. Soften the shoulders, and as you exhale, bring closing the gap between the body and the thigh. Now, in some cases, we may need a blanket, a block, or a blanket underneath, but let's go into it first. So bring the body closing the gap between the body and the thigh. Stay where you are. If this is comfortable for you, stay. Breathing out, holding the pose. Don't worry so much about your back. Just go into the position that you could feel comfortable about. And inhaling, looking up, keeping the back straight. You need to engage the muscle of your core muscles. Press your heel maybe to the floor and coming up. Exhaling. You may engage even the other leg to press yourself down and the heel down. Your core muscles and the strength of your arms and your breath come out of the pose. Now, some of us may need a block to support the other leg. So please do so if you need to have a block underneath, or have a blanket underneath your knee if you need to. Even sometimes you may need under the heel because it can be quite straining to press onto the floor. So the left foot is next to the right thigh. For men, you may press into your Muladhara chakra if it's comfortable for you to press into Muladhara chakra. Otherwise, just leave it where you're comfortable for this first round, and subsequently you may try that. So turn, inhaling, lengthening, turning to the right leg, looking at the tip of your toe, breathing in. As you exhale, breathing out from the belly, breathing out completely, closing the gap between the body and the thigh. Just go to the position you're comfortable with. Do not push yourself too much. You may even use a block in some cases to support your head. It's really nice actually, if you need to. Next inhalation, bring up your neck first, in line with the spine. You may push yourself up if you need to with your hands, otherwise lifting the arms. Engage your core muscles, your abs, lengthening, inhaling, exhaling. Change direction. The rhythmic movement is really very important. I mean, the breathing in and breathing out in the pose, because it sort of brings calmness to the mind as you do the pose. Okay, first then bring the feet to the foot to the side of the leg, inhaling. Again, beware of the muscles in your rib cage and all that. You might pull it if you're not careful, if it's too strong. Exhaling, closing the back, the body and the thigh. You may bend the knees if you need to in the beginning, so it helps to, easy for you to go into the pose. Or you want to keep the leg straight, be it, but do not exert the back. Watch your lower back. You do not exert too much pressure on the lower back. Inhaling, neck coming up. Exhaling. This pose is also very effective for the lower chakras. Helps strengthen the legs, the muscles, the nerves, especially nerves of the lower chakra. Inhaling, exhaling. Be exhaling, core muscles engage. As you go down, take the pressure off the lower back. Do not exert it too much, because in cases of who had herniated bulging disc, you don't want to have a recur of that. So you want to be aware that you do not exert that pressure when you're going down, when you're bending forward. And next, inhaling, neck, pressing into the floor, engaging your abs, your abdominal muscles, core muscles coming up. Exhaling, release. We are holding for about 8 seconds. You may do less or more. Generally, 8 seconds is a good count for us to keep the cycle of remodeling also of the bones. Exhaling. Now, in some cases, you may need to round the back. Please do so if that's more comfortable. It takes the pain off from your arthritic conditions. Otherwise, the back straight. Again, exhaling. Inhale. Exhaling, release. You can see now as we go down, as we stay in the pose, we are in a state of exhalation and we're holding it to up to 8 seconds, inhaling, or less than 8 seconds. Again, exhale. Really, it's really nice to have the head on the leg. So if you cannot reach, use a block, and it's really relieving. Inhale, coming out. Last round. Inhaling, exhaling. I usually avoid this asana if I have a terrible throbbing headache. I find that it might aggravate in some cases because of the strain of the entire back muscle. However, it is very useful for conditions of nerve impingement like sciatica. Inhaling, exhaling. So let's go into Shavasana. Feel the difference between doing the asana in a fast pace and in this slow pace, in rhythm with your breath and the movement. The breath moves the spine, moves the arm, the difference. It affects your mind and body. Next inhalation, just get ready to come out of the position of the Shavasana. We roll up, but this time I feel like rolling to the right side. And slowly push myself up using the knees bend, the arms to come to the position. It helps to prevent injury of the lower back, especially if you have back conditions and all that. You don't want to put a lot of pressure coming up. So you use your hands and your legs to come to the position, to the sitting position. Janushirasana. When can you not do it? Especially if you have back problems, I think, because obviously you can go into the poses, the bending pose, and all that, the inflammation of the back, lower back. Knee conditions should be okay, but be careful when you get into it. You do not want to strain that area, lock the knee. You do not want to lock the knee when you get into the pose. So yes, the benefits are tremendous for the lower chakras. It helps prevent overcome indulgence, especially. Okay, and also this is a forward bending pose, so it's very calming for the body. The next pose I'm going to do is Utkatta Vajrasana. Utkatta means difficult. Janushirasana means head, head to knee. This pose is Utkatta Vajrasana, which means difficult Tanda pose. Vajrasana, there are many ways to do Vajrasana, right? This is also Vajrasana. This is Vajrasana in a sitting pose. In some cases, this can also mean Vajrasana. So Vajrasana pose is always very useful to do, especially after eating, because you want to bring the blood, attract the blood to your digestive system so you can digest your food. So it's really nice to do it. Or of course, another way is to lie on your left side so the right nostril is predominant, so it's digesting your food. And another way is this Utkatta Vajrasana. I find this Utkatta Vajrasana is an instant way to digest your food It's instant, means immediately digest your food. But it can be very difficult to sit in this pose for some. So please be mindful of your knee. The pose can strengthen the knee. I have done this over time to strengthen my knee. That's why I know for sure that is, although it says that it strengthens the knee, but it can be very taxing on the knee, especially if you do not do it carefully, if you are careless about the poses, you overexert the pose. Now, I want to do it while lying. You can do it starting sitting. I will show you, but please don't try if you're not sure if this is comfortable for you, because I will show it lying down. It's much more, it's easier to, for me it's easier to do while lying down than sitting. But to go into it sitting is to place, the ultimate is to have the toes pointing side, but it can be very trying. So don't try it in the first time. Just leave your knees, your toes behind, and then some of us may need support on the upper part of the body, just in case, but you can do it. I will show you how it's done, higher even, but some of us do not. So just stay like this and slowly lower yourself down to the lying down position, but this can be very trying and stress on the knee. So if you don't want to do that, another way is to be from the lying down position. We can do one leg at a time. First, I'm going to do about 3 sets. We're going to do one leg at a time. So we bend. See the left knee, the right is bent, left knee bent. Just stay in that position for a while. You can keep the right leg bent like this, or you could straighten that if you find it's easier. So stay for a while. I'm quite flexible with this, so that's why it looks easy, but be careful. If you're a bit heavier, you may want to move to the side and just do this. So you can just, especially if you have very tight front of the thigh, your glutes is very, quads is very tight. So you may want to do it on going onto the side. Otherwise, just lie down, stay for a while. Do one at a time. You're going to do 30 seconds. And you understand also the tightness. It may go into your knees, so beware of the tightness on the knees. So you don't want to exert that. You may want to come off it a little bit before you go all the way. Or you may want to get onto your right side more, so it doesn't give you that strain. You're holding your ankle. Gradual stretch can be quite okay. You feel the stretch coming from your lower part, your lower back as well, or rather more on your hip area, the sacrum area. And then release that leg, release the left leg, and bend, and then we'll do the right leg. You can see clearly, I think, on this side. So I'm just going to leave it like this. Again, the left leg can be bent like this, or it can be straightened, whichever you find more comfortable. Some cases you might need to have a block to support this. You can put the block on the left leg just to support it. It might be easier for some cases, because especially you might feel the strain of the knee after the stretch. Okay, you can put it under. Stay for a while, another 20 seconds, 15. You can do that, you can bend. And then slowly release that right leg, straighten, and come to the center. We're going to do another set, more than another set, 3 sets you're going to do. Again, left side. Now if you find you're able to do both sides, then do both sides. Your legs may not be together. The ultimate pose is to have the knees together, but not necessarily if that's very straining on your knees. Okay, so both legs are bent. It may be straining to have it facing out, so just have it face back It's perfectly fine. Again, you find the difference. I find that this is not the final pose. Actually, that's how the legs are. The arms are actually crossed at the back. They're crossing the back. I didn't want to do that in the first round because it can be very straining on the knees, so arms are crossed behind. That's why we could use a block, or sorry, not a block, a blanket to support your upper back if you need to. So it's not so straining on your lower back. Depends, again, or a blanket under your bum, which can help relieve the pose. So the arms are also crossed and the legs are in Vajrasana, in the bending position. Another 10 seconds, because we have spent time on the legs. The next round we will do, the next 2 rounds we will do the arms and legs together from the beginning. You can feel the muscle just easing off into this pose. It's gradual and slowly come off. Relieve the arms and the legs. That's why don't go to the maximum. Just go into the position that is comfortable, and you'll find that it goes a bit harder and harder and harder to get into. So straighten the legs. Just feel the effects of that before we go to the before we do another round. We want to shake it out a little bit. Okay, we'll try this time both arms and legs. Now I want you to put some blanket to see the difference if you want to. And then the last round we can do without. Just the upper part of the body, maybe even on the lower part of the body, the sacrum. Okay, let's do the legs. The knees can be together if you can do it, otherwise keep it apart. Toes maybe pointing to the side. Then the upper body. Make sure that the blanket is not just on your neck, it's just also on the upper part of your shoulder. And then bend across the arms on the back. You usually stay for 30 seconds, but I have done this longer than that because I find it such a relief on the back. But please do not do too long because it depends on what the body needs. We have done a few rounds, so it's in combination, it's not just 30 seconds, it's times 4, so it's more than that. Halfway through, you may change your arms if you want. It's more than halfway, actually. We're going to release the pose. You can do alternate and slowly release your arms, and then carefully release your legs. Now, you see the difference if you have something under your sacrum and the upper part of the body. In some cases, it might be useful. Just go into Shavasana. We're going to do one more round. So the full rounds of the asanas can be very strong. So you may consider doing less number of rounds if that suits you. Let's do the last round. If the last round is too much for you, you may stop and go into Shavasana. Again, be careful of your ankles. With any knee injury, it's really difficult for you to do. So you need to watch how to do the asana without injuring yourself. Across your arms, you may want to do the opposite way from what you have done with the other round. Very slowly remove your arms and your legs very carefully. Very, very, very carefully, because really it's very straining on your toes, the arch of your feet, and your ankles. You may want to bring your knees to your chest and release. Knees to the chest, breathing out and release. This pose is very taxing on your ankles, toes even, heels in some cases, knees, sacrum, lower back, shoulders, arms. So if you have any injury to these areas, you should do it carefully. If you have acute conditions to these areas, you should in fact avoid doing this asana. I'm going to come out of the Shavasana. Come out slowly to the sitting position. I will explain a little bit of the benefits of this pose, Vajrasana, Utthita Vajrasana. But I find it very useful for lower back conditions. It helps to release a lot of tension, especially the stress area, lower back. Helps digestion, immediate digestion. It relieves through the tension as well. It's a tanda pose, so it gives you a kind of youthful feeling as well in the pose. But those who have conditions that I've mentioned, be wary when you do the pose. Be very careful when you do the pose. So you can combine this pose with any forward bending poses if you like, to give the overall feeling of the session that you do. And you can also do with other standing poses in your practice. You can, if this is the last pose, you should finish up with massage and then Shavasana. So yes, I hope you'll try the pose, but please be careful with the poses, with this pose that you're going to do if you're trying it. Make sure that you don't have any conditions that is prohibited before you try it. Thank you. See you at the next session. Namaskar.